Hi, I wanted to talk a little bit about the two common pregnancy walking patterns that I shared on a reel yesterday. The first is the duck walk. So, the duck walk, you don't even need to be pregnant for the duck walk to happen. If you're a ballet dancer, you're probably walking this way a lot, anyways. So, the duck walk is when you walk and your feet aren't necessarily pointing forward, they're at kind of an angle. And as pregnancy progresses, it can kind of turn into a waddle sometimes because it just gets so turned out. But that alignment happens way up here in the hip. And it's usually due to the deep external rotators getting tight. And then that pulls this femur bone into an external rotation. So the reason that this isn't ideal when you're pregnant comes about later with labor and delivery. So when you are in an external rotation, it's due to these muscles in the back of the pelvis here being tight, the ones that connect your femur into the pelvis and into the sacrum. And when these get tight, you can see what happens to the bottom of the pelvis when these get tight. The bottom of the pelvis gets smaller. Now you can feel this on yourself if you're to get into all fours and let your legs spiral into some turn out and turn in. You can almost feel the widening and the coming together of those sits bones depending on if you're in internal or external rotation. So when you are walking with that, if you find yourself walking with that duck foot turn out, chances are the back here could be tight, and that could also lead to a tight posterior pelvic floor as well. So again, that would end up shrinking this pelvic outlet, making it making it more difficult during the push phase. The second walk I showed was call it the washing machine or the oscillator, and that is a result of your hip not being able to find extension during the push-off phase of gait. So instead, if your hip won't extend, the whole thing will spiral backwards so that it becomes kind of this over-exaggerated oscillation movement. And that's usually a result of a tight anterior hip, so tight front of the hip, like I talked about in the sitting video. So go check that out if you haven't already. If this gets tight, it makes it hard for the hip to extend. Like I said, so instead the whole pelvis just starts to oscillate while you walk. Now, the reason that isn't great then when you are delivering is because hip extension, when the hip goes back, hip extension can also take this pelvic wing along with it, especially when you're pregnant and all that relaxin is coursing through your body. It makes these joints way more mobile. So when your hip goes into extension, what ends up happening is, let's go with an overhead shot. When your hip goes into extension, you end up creating more room here in the pelvic inlet. So this takes that this part of the sacrum, this bony protuberance, it helps pull it out of the way. Get the best 2D angle on a 3D model. It helps pull that out of the way so baby doesn't get stuck on that when trying to descend into the pelvis. So hip extension is super important. This is, again, really over-exaggerated, this model, so that you get that front to back space for baby to come in. So if you are finding that you're doing this whole shift with the walk and you're not finding that nice extension of the hip, we can do a lot to work to release the front of the leg, strengthen those muscles once they've been released, and then also strengthen the muscles in the back. So actually, for both of these types of gait, either your duck waddle or your washing machine, glute max exercises are going to be a great way to kind of kill two birds with one stone, because when you get the glute max to start supporting a little bit more, then those deep rotators can calm down. We're not in the duck feet anymore. And when you get the glute max again working, that is a primary hip extensor, so then we can get that push off and not do the washing machine. So that's the quickest way to, not necessarily quickest, but that is a great focused way to, again, two birds, one stone. So I hope that cleared up ways to address those obscure pregnancy walking patterns. And if you aren't sure which one you're doing, if you're maybe doing one or the other, come take a walk by me and we can see what's going on there together. I hope you have a great weekend, and let me know below if something aha'd for you or if it made some more questions. Have a great one. Next in this video, you're going to see some sample exercises to help you reset, realign, and reload your external rotators, glutes, that whole hip muscle complex. So the reset means we activate that muscle, get the blood flow, then stretch it out so we kind of get it back on board. Then the realignment comes with movements that you would do throughout your daily life just to kind of repattern them in your body. And then the reload comes from adding weight to that repatterning, or to do some other exercises that again also add load and add weight to help build the muscle. If you want the full class that these clips are taken from, you can get it down below. Begin by warming up the external rotators through some outward knee pulses, adding a straighten and a bend to give yourself a little break in between. Then go ahead and do a figure 4 stretch or a pigeon to stretch the external rotators. Then we repattern our movements to use more of the glutes. So alternate a hip hinge and a squat. Feel free to add weights to make it a little bit more challenging and grow those muscles. Finally, we work on the internal rotators through a booty band and making the foot go outside of the knee for internal rotation.